Hi everyone, I'm Aaron Luby. I'm the Director of Clinical Training for Miami University's Clinical Psychology Doctorate Program, and I'm here to welcome you to our virtual interview day. Now, you obviously can't see me, but I'll be walking you through a bit of an overview of the program so you can get a sense of our philosophy, what the curriculum looks like, some of the research opportunities, the clinical opportunities that we have, as well as some information about finances, the admissions process, and ultimately the outcomes for our graduate students. So I'm going to break this up into a number of different components, each of which should hopefully only be a few minutes. And then when we get together to meet in our virtual room for our interview day, hopefully I can answer whatever questions might still be lingering out there. So first I'd just like to tell you a little bit about Miami University, our department in our area, as well as walk you through a little bit of the coursework that you might expect to take if you were to come to Miami. So Miami University has about 16 to 17,000 undergraduate students. It is a public university, despite what you may have thought. In fact, our marketing department loves to use the phrase public Ivy, which was denoted in some publication in the 1980s. But I think Miami does have that reputation of being an excellent school and excellent education. Now, it is also true that we have fewer doctoral programs than maybe other large state institutions might have. And so you'll hear the phrase selective excellence in graduate education thrown about here at Miami. Now what this means is that we're one of 13 doctoral programs in the graduate college, even though we are one of the largest majors in the College of Arts and Sciences. Currently we have 1,100 majors in our department. But what this means for you, if you were to come here as a graduate student, is that although we are only one of 13, I think this gives us a special place in the university. We're looked upon favorably because of the high level of research that we do in the department. We're also really looked at favorably for the level of sort of scaffolded mentoring that occurs between faculty members, graduate students, and undergraduate students in our department. In fact, we have about 400 of our undergraduate students who are actively engaged in independent research in any given year. And of course, a lot of that mentorship comes through the great graduate students that we have in our program. Getting a little bit more specific to the department, our department has 3 different areas in the doctoral programs. We have a program in clinical, obviously, that you've applied to, as well as areas in social, brain, cognitive, and developmental. We throw those 3 in together, BCD. And that's where we also have folks in behavioral neurosciences live under that BCD level. There's a lot of cross collaboration among the different areas, and I think we work together very well. For example, several students in my own lab have worked with individuals from the developmental area. Other faculty members and their graduate students have collaborated with faculty members in social on things like students in April's lab have collaborated with Dr. Jeff Hunger on some of eating stigma and weight stigma in the social area. Other students have been involved in collaborations with the cognitive area, doing EEG work. For example, in Dr. Keel's lab, some of her students do EEG work with Dr. Thomas in the cognitive area. And those are just a few of the many collaborations that occur across our different areas. In terms of size, the clinical program typically admits a class of about 6 students, and so at any given time there's about 30 to 36 students on campus, with some of our students off on internship, and then together social and BCD bring in about 6 every year. So at any given point there's about 60 students in the doctoral programs. Our clinical program, getting even more specific, takes a scientist practitioner model. We have a developmental evidence-based practice perspective. I think we do a wonderful job adhering to an ecological model. For example, you'll be trained in interventions with individuals, with parents, with family, with communities. So if you think about Bronfenbrenner's model, we really do focus on many of the different levels of that model. There's a diversity of research methods, that we employ as well. So it's true that a lot of us do work with psychophysiological methods, but also observational methods, community participatory action research, global mental health. So again, you can see how we attack things from both the biological standpoint in the individual, as well as family relationships and peer relationships and other kinds of relationships that are important for individuals, to the community level and across multiple different types of cultural contexts as well. So again, I think we do a really nice job here adhering to that scientist practitioner model, thinking developmentally, thinking about what's best practice, but thinking about individuals within context. We are, of course, APA accredited. We were scheduled for a site visit this past May, but are planning another one. I say May here, but it'll probably be in April. We're trying to figure that out, and it'll be a virtual site visit. I would imagine to have no problems moving forward. We are guided by values. This is a large slide here with a lot of words on it, but what I've posted here is our department's diversity and inclusion statement. There will be opportunities during the virtual interview day to learn more about our diversity, equity, and inclusion activities. We have a very active DEI committee that's comprised of both faculty and graduate students, as well as I believe a few undergraduate students that are engaged in thinking about programming for the departments, for our faculty, for our students, for our staff, with the idea that, you know, bringing together the best values that we have of including diversity and inclusion, thinking about equity. You can read this statement here, it's on our website as well. But I think that all of us in the clinical area in particular are driven by these values as we strive, although we still have work to do as we think and learn more about how to best, for example, engage in anti-racist work, how we best engage in decolonization of education, but we're all striving to create an environment at Miami that is guided by these ideas of equity and inclusion here. And so you can read our value statement on this slide or on our website. As many of you know, as you've been looking around our website, we may be a smaller program than some other places that you might be applying, but we have a great faculty here comprised of basically 11 core faculty with an affiliated individual, Dr. Meehan. We have 8 tenure track faculty that you see listed here. 4 of us primarily work with and study children, adolescents, and families, and 4 study primarily adult populations, although there is a lot of overlap. I myself study emerging adults and have done some adult work. Certainly Dr. Ravel has done some global mental health work spanning the lifespan. Dr. Smith, Dr. Messman-Moore study concepts that might be relevant for adolescents, like eating disorders or things like trauma and long-term outcomes of childhood trauma. So there's a lot of cross developmental focus here, but we do have kind of 2 areas within our department, one focused on children and families, as well as one focused on more adult populations. There aren't specific tracks per se, just a series of guided experiences both in coursework and in some of the clinical opportunities that we'll talk about in another part of this introduction. We also have 3 of our faculty members who are labeled as clinical faculty. These individuals are primarily the folks involved with our wonderful supervision that you'll be receiving in our clinic and in some of our community-based placements. So our clinic director is Dr. Evans Tobin. She was recently hired, and this was her first year in the position, and also Dr. Green and Weesey, our clinical faculty. As I mentioned here, and you won't see in our introductional video, Dr. Cricket Meehan is the director of the Center for School-Based Mental Health. They are an affiliated program, and she does some of the work sometimes with helping to supervise some of our clinical students in different aspects. Some of our students also work in the Center for School-Based Mental Health, and I would imagine there will be some even more opportunities for that. The center was just actually awarded a $6 million grant from the state of Ohio to improve mental health care for students throughout schools all throughout the state. It's a wonderful collaboration and one of the biggest grants that Miami's landed, and so much kudos to Cricut, and I think there will be a lot of opportunities for students to be working on some of those projects. I want to walk you through a little bit of our curriculum. I should mention before I do so that for the faculty, we also have, hopefully you've seen it, the introductory video where we each describe some of our research interests, some of our teaching interests, and give you a better flair for who we are, so you can see our faces a little bit as well. In our curriculum, I want to walk you through sort of what the overall plan looks like. Now, this is sort of the typical curriculum for an individual coming in without a master's degree. If you are a person who currently is in a master's program or has a master's degree, some of these pieces can be truncated, or maybe some different activities take place. And so I'm happy to talk about that and answer questions that you might have. But typically, students engage in coursework throughout years 1, 2, and 3 with a lighter load in year 4, maybe on occasion a course in year 5, depending on what students might need. In terms of clinical work, that typically picks up in year 2, although there are some opportunities in year 1 for certain things, and that continues pretty steadily throughout years 2 through 5. And then our students are off on internship in year 6. So students apply out in year 5 and land on internship on year 6. Much more information about all of this to come. And then in terms of research milestones, we have 3 particular milestones: the thesis, the comprehensive exam, and the dissertation. The master's thesis is typically worked on in years 1 and 2, the comps exam in year 3, and then dissertation is worked on in year 4 and 5. About half of our students defend prior to leaving for internship, and half defend while on internship. And so most of our students, almost all of our students, graduate in 6 years after the end of internship and wrapping up the dissertation. We'll talk a little bit more about comprehensive exam in a different part here. We have 2 options, and that usually happens in year 3, as I mentioned. The coursework that you'll take is a developmental, sequenced, and graded in complexity level of coursework. These are things that you'll probably find across many different programs that you've applied to and might be interviewing at. In years 1, we typically have lifespan developmental psychopathology, ethics, and students take an adult intervention course. In year 2, you'll take some didactic coursework in assessment. We have a 2-course sequence in assessment. Either in year 1 or 2, if you're interested in working with children and families, you'll take this child intervention course. Both of these intervention courses focus on evidence-based practice. I would say that students are exposed to didactically things like traditional cognitive behavioral therapy, third wave approaches, interpersonal approaches, as well as in the child intervention class, some family and community intervention. In either year 3 or 4, our students take our multicultural issues course. We have a specific course dedicated to multicultural psychology. We've particularly been thoughtful about placing the course in year 3-ish 4 in order to maximize the idea of having some clinical experiences before engaging in that course, although we infuse other sort of didactic and experiential activities in earlier pieces of our curriculum. Obviously, we know this is important information from day 1 as we're all working on developing our cultural competence and improving in our cultural humility, and so we infuse it throughout, but have our dedicated coursework usually in year 3. In year 2, then, you'll be taking some clinical practica. These are child and adult focus and assessment. We'll talk more about how this works in a bit here. There's also advanced coursework in supervision and consultation. We have specialized coursework that includes advanced clinical seminars, independent readings, and a teaching practicum for those of you who might be interested in teaching. Students can be the instructor of record in their 5th year in the program. As with all other APA accredited programs, there is coursework in what is called domain-specific knowledge. These are the ABCDS, affective, biocognitive, developmental, and social bases of behavior, and we also have an independent readings in history and systems. We do combine our affective and developmental components. There are several of us who are experts in emotion development, and we thought that was a nice combination of opportunities there. So that is the coursework. I'm actually going to go back here and leave that up here. The other piece I didn't have on the slide that I will mention is our stats sequence, and I should have put this on here. But essentially, the stats sequence is a 3-course sequence. Students in their first and second semester, so in their first year, both semesters, take our 2-course sequence in general linear models. The first course covers regression techniques. The second course covers primarily ANOVA kinds of techniques. Then students have the option to take a third course, or they have a requirement, excuse me, to take a third course, but you have the option of what that third course is. So on a rotating basis, we offer an advanced regression course that primarily covers things like multi-level modeling. I offer every 3 years a structural equation modeling course, and Dr. Ravel offers a mixed methods course in learning qualitative and mixing it with quantitative methods course. There are also opportunities outside of the department in our statistics department. You can take one of those as your third option. Those include some things like data visualization courses. There may be some nonlinear options over there as well. There is, in addition to our required 3-course sequence, students can earn a graduate statistics certificate, which requires just one more course over and above the 3 that are required in the department. That course has to be outside of the department in something like statistics. So a lot of our students, especially those who are planning on an academic career, do try to take advantage of some of those opportunities. All right, that's what I have for our philosophy and curriculum. In the next couple of videos, what I'll be talking through is some of the research and scholarship opportunities that we have, some of our clinical work, and then I'll wrap up with some of the other big picture pieces to our program. All right, see you at the next video.